This is your fortnightly instalment where I interview a trailblazing physiotherapist that has shaped the profession we are today. In celebrating their journey, knowledge and insights, you gain the opportunity to plan and guide your own professional journey. My name is Doug Carey and welcome to Physio Plus 10. Welcome past and new listeners to Physio Plus 10. Our special guest today is Michael Kenihan. Welcome, Michael.
Hi, Doug. Pleasure to be here.
Thank you. We usually start these podcasts with a bit of background, so where you grew up and your early schooling.
Well, actually, I'm an Adelaide boy, born in Tasmania. My father was an obstetrician, gynecologist in Adelaide. I'm one of 6 children. I'm number 4 in the list. Lived in a very leafy suburb, a nice area of Adelaide called Toorak Gardens, and really was a very, very sporty guy right from the get-go. But I had 4 sisters, 3 of which are older than me, and it's always a funny twist because my grandmother, my paternal grandmother, only had 1 son, my father, and she was quite disgusted that my mother continued to have children, and even more disgusted that it took her 4 tries to eventually birth a boy. So I had a little bit of an easy run growing up because I was the first boy that was born, and that was important back in those days.
You were the heritage line.
Yeah, I was the precious boy that finally arrived to carry on the family name, and
So
then 2 more came after me.
Paternal grandmother ease up on your dad after that?
Yeah, I think so. I think her opinion was more about my mother than about my father because my father couldn't do much wrong in her eyes, but she just blamed the mother for continuing to get pregnant, I think.
So that extension would go to you that you could do no wrong in your grandmother's eyes?
Pretty much, but, that also created the firstborn son. What are you going to do? That's probably part of it too. Didn't matter what the girls did, but it mattered what the boy did. And for those who are very young here, that was the era. So I'm not in any way propagating that as a good idea at all. As my sisters will constantly tell me, there's nothing special about you. I understand.
Thank goodness for siblings. Hey, that brings up a concept though. Like, did you feel, and we're going to probably get into this a little bit later on, but was there a pressure expectation, given your dad was a gynecologist, which is kind of the peak of the tree for in the medical profession as a specialist, was there that sort of pressure on you to follow, maybe not in the gynecology direction, but in the medical direction?
Well, actually no, because my grandfather was a specialist physician, general physician as well. So even though I was the 3rd generation, no, there wasn't any pressure at all. And in many ways, back in the days when my father was in that role, that was a hard yakka being an obstetrician because they delivered all the babies themselves. So memories of my father were that he was always working, even day or night, and my parents were always awake because he was always woken up in the middle of the night. And this is before pages and emails and communication and mobile phones. So whenever we went out, he had to give the number of where he was to the hospital so that they could contact him in case he had to go and deliver a baby. So I think from an early age, we all understood that was a tough gig, and he at no point ever said, "Oh, look, there's an expectation that you will enter that field." So that was good not to have that pressure, actually.
Yeah. Can you recall being fascinated by anything, particularly as a child or a teenager? And has this kind of reflected on your choices and outcomes that you've made in your life, career, and journey?
It's a really good question. I was, as a very young boy, fascinated by words. I used to create mythical monsters with funny names, like, Pulatida was one of the ones that I created, and it was a mythical monster that I enjoyed playing games with. And I very early in the piece had a real passion to understand about life and about growing up and about how the world worked. So I guess I had quite a philosophical bent on things. I was raised by the Jesuits, and they were academic in their approach, and there was a lot of emphasis on education. But really, the thing that very early in the piece I realised that I was quite good at was sport. So I was an underage high jump champion from under 10 all up until I became state champion when I was 19. So sport was a very big part of what I did, and probably directed me towards wanting to treat athletes and at least look after injured persons. And that sort of drove me towards a career that was either in sport, teaching, sport management, and then somebody suggested to me, oh, well, you should do physiotherapy, because then you could actually treat the injuries and be more involved in that process. So that's really the path that I actually took, really from sort of mid-high school through, and knew what I really wanted to do. And that was also assisted by the fact that I was unable to high jump after age 19 because I got an ankle injury, and I was unable to continue playing football because I did my ACL. So the idea was, well, you're really involved now with treating, wanting to treat athletes and wanting to work in sport. So that sort of the injuries directed my path towards being a physiotherapist, but that bent was already established before I got the injuries as wanting to be involved in that field, and very much encouraged by my father, who was very pleased to take me to the medical bookshop and pick up books that he was familiar with. And I guess that satiated any desire he might have had to have somebody medical take up the reins from him.
Can we just go back to, you were raised by the Jesuits? Do you mean you went to a Jesuit school, or your parents were Jesuits, or both?
No, I went to a Jesuit school, which at that stage was run almost entirely by the Jesuit priests. Most of my high school teachers were Jesuit priests, and I'll never forget a very passionate priest, Father Macarivi, who taught classical studies and Latin, and I really enjoyed those subjects and delving into the ancients generally, but also language, which really led me to then later on become interested in studying Spanish. So I learned Spanish as something else as well. So it's funny the way these things that sort of happen to you when you were younger transmute into what you end up doing when you're older, almost not directly, but by accident in some instances.
Yeah. So essentially you're an athlete before you're a physio, but the two were linked together.
Yep. And the injuries were mounting up with a stress fracture in my back and an ankle sprain and an inflammatory process at the bottom of my fibula, which didn't enable me to take off anymore with a high jump when you plant your foot. And then the ACLs and the knee reconstruction. And back in those days, the knee reconstruction was pretty brutal. Leg in extension. They took out the lateral meniscus as well because they thought that was a good idea. And as we all know, that's not something that you do. A, you don't do that now, and B, you don't immobilise knees like they used to back in those days. So it's left me with a few battle scars, Doug, moving forward.
You chose to study physio. Did you also specifically choose the location?
Look, I'd finished studying at high school, and at that stage, I had no intention of moving anywhere else. So University of South Australia ran the only physio course at that time. There's more courses available now, but also back in those days, it was mainly a female profession. We had 32 in our year, and only 4 of us. There were only 4 males in the course, 28 females. So that had its many advantages. With the diligence of the females used to help with the studying, and we ended up having a lot of fun being surrounded by. I'd been brought up with 4 sisters on either 2 or 3 above me and 1 below me, so I was well and truly used to the girls. But it was a really good experience then going into uni and studying in that environment. We had a lot of fun because back in those days, Doug, the government paid for your tertiary education, unlike now. So therefore, you didn't have to have the demands of work and a job and earning an income to actually pay for your course, and you weren't left with any legacy of a HEX bill. So, I mean, they were great days, the mid-70s, when those things were available to us all.
Yeah. You graduated in 1977. What was significant
Correct.
for you about your university experience? Given that you come out, and I guess I'm just emphasizing a bit because you're just coming out of Jesuit training, which I'm guessing was an all-boys school,
Yes.
and now you've gone
All
into
school.
a
Yep.
female-dominated profession and classmates and colleagues. Was there anything specifically significant for you doing the university degree thing?
Look, I think there was a real dearth of male role models back in those days. We were fortunate that I came in at the end of Jeff Maitland's still teaching in year 3 and year 4 of physio, but there was really a dearth of males, and the males tended to be involved in the musculoskeletal area, not the other areas of training. And really the experience doing that, look, in many ways it was, look, I'll be really frank with you, as budding new physiotherapists, we tried to get through with the minimal amount that we could do. A lot of people say that, but it's the truth. So we didn't apply ourselves as well as we could have. And it was only towards the end of the course and looking at the diligence of many of the friends I had who were girls that we really started to ramp up and focus more in 3rd year and 4th year on our study side of things. But in terms of the environment, I just think it was a more gentle environment, having so many females, and not only that, most of them were the same age, because there weren't a lot of older age entry people going into physiotherapy at that time. I think we had one girl in our course who wasn't a school leaver, so it was a bit like a party in many ways, because you would know you spent so much time in physio course, or you did then, on the campus, and we did everything together. And we have great memories of going camping. I met 2 buddies I've still got that were surfers, and we started surfing really when we were 17, 18. We used to go on camps, and many of the female students would often come with us to various parts of South Australia. So I guess it was the camaraderie that we developed with that close-knit unit and got to know the people really well. That was a really wonderful way to go into tertiary education, where you weren't a number, you were really engaged with the people that you were studying with and part of their lives, which I think was a very endearing thing at that time.
Yeah, it made for a real experience, didn't it? Like the whole uni experience was quite different to what you hear about it now.
Oh, the uni experience was, fabulous to be able to do that.
Now,
Yep.
I didn't ask this question like in the prelim, but I just suddenly thought, did you meet your partner at uni?
No, I didn't actually.
Okay.
I didn't. I met her in Melbourne later on, but that sort of, I didn't actually stay in South Australia for very long after I graduated. And what I was fortunate, my first mentor was a fellow who became my best man and the godfather to my first child, my son. And Tony Williamson was his name, a very dynamic guy who was studying postgrad MNIPS at Royal Adelaide Hospital, where I was working. And we used to have a bit of interaction with the people doing that course. It was run by Pat Trott and Maitland at that time, a 1 year, pretty much full-time course. And Tony took me under his wing and really got me interested in a potential pathway towards a career in sport and sports medicine, because, he was very well regarded by the orthopaedic surgeons and the sporting community, and he knew a lot of people. He was 5 or 6 years older than me, maybe 6 or 7 years older than me. So he became a mentor to me and taught me a whole range of different things about how to run meetings, how to get the best out of interactions with people, how to engage in relationships, develop referral bases and all those sorts of things, right from while I was actually working at the Royal Adelaide Hospital as a general hospital-based physio. So he was my first mentor, and that's a consistent theme through my work life, where I've managed to identify and tie myself into mentors who are able to help me. So after 1 year, Doug, of doing that in the hospital, I took off with one of my fellow mates who studied with, and we worked at the hospital together with a view to take a year off and go up the East Coast and go surfing. And it was Tony who rang me up in the middle of that jaunt and said, look, you've got to come back, Mike. I'm involved with the setup of a sports medicine clinic. It's unique. It's multidisciplinary. It's at a great location in Adelaide. There's a high-profile people. They're bringing in this equipment from America, Nautilus equipment, to rehabilitate people. There's going to be this new range of equipment called Cybex and Orthotron, which is functional testing equipment. There's a hospital next door, so people will go straight from the sports field if they need to the doctor, to the hospital, surgeons, etc., etc. And he lured me back and dragged me into his practice before this clinic started, which was at another hospital in the outpatient department, where he rehabilitated all the post-operative knees, the knee reconstructions. And I used to go there 2 afternoons a week and watch him and learn from him while he honed me in the skills of being ready for the start of that clinic at the end of 1978. So, one of my other messages to young folk is that I had that opportunity and I availed myself of it by spending time with him. And he taught me so much, and we had a chance to even work on the equipment that was coming in for this clinic so that we knew how we were going to use it and how we could work with it, because it was literally brand new to Australia, and functional testing equipment was a new idea. The rehabilitation ideas were moving forward. Surgeons were becoming more interested. So it was really Tony that pulled me into that business, and I became the first full-time physio at that clinic in 1978. And then, just to continue that story, I went to a sports medicine conference in Hawaii that Sports Medicine Australia had organised. Because the other thing Tony told me to do is you've got to join SMA, Mike. You've got to work with doctors. You've got to work multidisciplinary. You're going to learn so much. And back in those days, Doug, you would nominate to share a room with somebody at the conference. And I nominated to share a room. I ended up sharing a room with a guy from Monash Uni Department of Anatomy called Barry Oakes, who was one of the prime movers in sports medicine in Melbourne in the late 70s, early 80s.
Yeah. And
Barry befriended me and he found out what I was doing. He said, look, I know a place in Melbourne, in East Melbourne, where there's a hospital and a nurse's residence beside it. We need people like you to come and set up a sports medicine clinic. Would you be interested? And the great John Hart, who became a president of SMA and is a well-known orthopaedic surgeon, was working there. So I basically up sticks and went across as not just a physio, but an investor, because they let me buy shares in the business when it started. And I went across there to do a trial, and I never left. And met the likes of Peter Larkins and Peter Fuller and Steve Sandor and others who, became luminaries in sports medicine in Melbourne. And that was affiliated with Richmond Football Club, so working at Richmond Football Club, et cetera, et cetera, et cetera. So, that was just an opportunity, and I had the foresight perhaps to realise that moving away from Adelaide, which was I'm not critical of Adelaide, but it's quite insular and small, and the opportunities I didn't see as being as great as they could be in Melbourne with the number of the AFL teams and the professionalisation of sport. So I really saw a career opportunity by moving to Melbourne, which I did when I had been graduated for 3 years. I packed up the old Holden and drove across and made my path in Melbourne in those early years.
Yeah, what I like to find out from people in these sort of pivotal years, at sort of sub 5 years from graduation, is were there key people, key decisions? Was it deliberate? Was it chance? But you're sort of saying that there were key people, there were key decisions, but in some ways it was availing yourself of opportunities and taking them when they were presented, because a year later the offer might not be there.
Well, it's funny you say that, because a lot of people talk about luck and how you make a career, but I picked up very early the idea that luck is the awareness to take opportunities when they come your way. And the other thing is you've got to take action, Doug. You have to be prepared to go out of your comfort zone. I was leaving my family behind. I didn't really have that many relationships in Melbourne, and managing to, find your own feet was, and that what helped me was that after being there for 6 to 8 months, was actually a chance encounter in a restaurant in Carlton that a mate and I walked in there, and there was a table with 2 girls there, and they invited us to sit at their table. And one of those girls became my wife back in 1986. So that was a pure serendipitous type of scenario, but that's another example of, well, go for it. Don't be afraid to jump in if you like.
Yeah.
Yeah.
Yeah. Well, I think that's, you've taken you sort of say about making your luck, but I think you have to be open to it. And as you say, willing to take, usually I find it's coming from you're stepping out of your comfort zone. And by doing that, you're either meeting people, having experiences that you weren't or wouldn't normally experience. And then, it might be serendipitous, or it might be a chance meeting with somebody else that leads you on. And if you hadn't stepped out in that first place and made that uncomfortable decision, then the opportunity would not have arisen for you to look at.
And the thing about that is too that by putting yourself around people who you can learn from is crucial. And the learning environment at that first clinic in Melbourne, or actually the Adelaide one as well, but then moving to Melbourne was extreme, because the people that had very high expectations that, the catchphrase used to be, nobody leaves this practice without a biomechanical diagnosis, a tissue-based diagnosis, because Barry was a tissue scientist. So, we were schooled in the idea of not just symptoms and signs, but in actual, putting our hand on the heart and saying, this person's got this injury, what's the pathology, what's going to be involved in the recovery, how long is it going to take, back yourself in that, they'll be back playing this or playing that. And that was a very intense learning environment. And serendipitously, once again, when I moved to that clinic, the doctor who was managing the clinic decided to take a sabbatical overseas, and everybody looked at me and said, we need someone to be the manager we need someone to run the clinic, to do the administrative things and run those things. Do you want to do it? And I said, yeah, why not? And that became my, if you like, my business MBA from that point on, learning by doing, learning by picking the eyes out of whatever the accountants were saying, or whatever lawyers were involved with, or property leases, or those sorts of people. I really was plucked in the deep end to do that role, which I did for a number of, probably 4 or 5 years while we grew into a bigger group of practices. So again, that was jump in, could have said no. Mind you, nobody else was putting their hand up. But that tends to be the way it's been for me. Someone will say, are you interested? Do you want to give it a go? Yep. What's the worst that can do? What's the worst that can happen?
Yeah. There's something there also, like we're talking about, you've got to take the opportunity to take a risk. But the other thing I realized is that you were surfing, so you could have been heading on the world surfing tour, but Tony brought you back to Adelaide, so you hadn't peaked on the surfing yet. Then you're with Tony for a year or so, but he's building you up to obviously run this massive new clinic in Adelaide. You haven't peaked there, but then you take the opportunity into Melbourne. And then you're in Melbourne, you're sort of getting settled down. You could just get used to being a clinician for a while, but no, you forego that and you take on the admin role. And so it's kind of like, don't, your story to me so far is don't wait till the good is finished. If you're halfway through it, it's, you can bail then and take on something else.
Well, that's really ironic you say that, because I'm not necessarily on this call to push the book necessarily, but one of the things that I identified, when I started writing that book, was there are stages you go through in your career. It isn't necessarily linear. There are things you need to do. You need to be good clinically. You need to understand how to make a living out of it and grow businesses and work with people. But people can jump into those things at different stages, one before the other. It doesn't necessarily fall that way. But the reality is there is a bit of a structure and a plan that comes from the opportunity that's created for you. So if you're going to run a clinic like that, you have to then, I did at that stage, all you could do were short courses on business management, or I remember doing a practice manager's course out of the University of New England, Doug, it was actually not in uni, it was basically by correspondence. And doing those courses gave me some theoretical background to what I was doing. And then it was about applying the principles and utilising the knowledge that you were gaining and applying it in an environment that was open to it. It was, if you like, the guys knew that I hadn't had much training, so they accepted what I was doing and the way I was going about it and supported me. And that was crucial, because I couldn't have done it if they'd said, "Oh, mate, you're not doing a good job. We're going to get somebody else who's trained," if you like. So
well, they also knew that they didn't put their hand up, so they better not criticise too loudly.
That's right, yeah. Got to be a bit careful. I can tell you now, it took them a long time to value what I did, to pay me fairly for what I did, because for 3 years I lived on treating patients and not getting a cent for doing the admin role, till eventually I said, "Look, we've got 5 clinics now. I can't keep doing this. You better start paying me." And that was truly, it was hard yards, and it was not about, I often say this to clinicians, in the early years of your practice, it's not about making money, it's about learning and learning how to apply the knowledge you get as a preparation for then looking at how you might turn that into something that's commercially successful for you. And mine took a bit long to get there. And my wife used to say, "Are they ever going to pay you to do this?" And sure enough, eventually they did, and they recognised the value that I had. And I was able then to diminish the clinical time that I spent over 10 years, from full-time to part-time to 3 afternoons to 2 afternoons, then cease the clinical work altogether.
Speaking of admin, it's a good segue. You've had various admin roles, as in GM for Life Care Health, you're past president of SMA, and you're a director of an online learning and education platform. Would you say these were deliberate progressions in your career?
I think, look, the stimulus for getting more involved in the going towards a corporate direction or a more business-oriented direction was in 1995, when I wasn't really practicing as a physio much. I was just practicing a little bit, and we developed a partnership of 14 partners, Doug. We had accountants, we had podiatrists, we had doctors, we had physios, and some, luminaries of the day. One of those partners actually was Lynn Watson back in those days. And we got to the point with the partnership whereby it wasn't working anymore. There was fragmentation, there was disaffection amongst the partners. And we were smart enough to bring a business consultant in at that time who was more in marketing. And he said, "Oh, what's your plan?" We said, "Well, ultimately, we'd like to sell the business." And in 1995, he helped us set a strategy called Build to Sell. And we developed this strategy over 12 to 18 months. And then we had a really good idea of what our value was, what specific attributes the practice had, all these types of elements we put together in this plan. And then, we were ready when Lifecare came knocking on the door in 2000, because Lifecare were looking for, you would remember this, they were looking for a beachhead or in the eastern states, moving out of Western Australia, and they were looking for a group that they could, be involved with. And Sports Medicine Centres Victoria had, 5 sports medicine centres. We had, significant turnover of $2 or $3 million. We were making a profit. We had good people. And so they came along and bought us. And because I was the person that did the negotiating with them and had been the manager, they said, "Oh, do you want to, will you come and be a member of our executive team and work under the board, under Richard Bevan, actually?" And I said, "Of course." I said, "Sure. Where do I sign?" And that started another journey of new level of learning of how the capital markets worked, how corporates work, how you can teach people and how you can put systems and processes in practices for improving not just the business side of the practice, but the clinical side of the practice. And at that time, we had a young physio come to us who was working with us in 95 by the name of John Ford, who you interviewed in this position before. And John developed his back functional restoration back program within the Lifecare spinal management group that he established. And then when the corporate environment came along, John and I really studied up with the MDs that we worked under, one of which was a very big 6'5" SAS soldier. He wasn't great at running the business, but he was a fabulous consultant and teacher. And that became another level of opportunity and learning. And I attached myself to Ralph as a mentor, not just as an employee of his, but as I took him on as a mentor. He didn't really know it, I don't think, but I saw him as my mentor to learn and grow some of the business skills and some of the, the systems, and understanding key performance indicators and understanding practice growth and understanding, market. And one key thing that he taught me was that if you're wanting a relationship with a referrer, it's a two-way street, So what is the benefit of a GP referring to you and what is the risk? Because by understanding the benefits and the risk, you would then promote the benefit and mitigate the risk of the referral. So there were some really good truisms that he taught that, a lot of what I've learned, I've thrown into this book, but some of that I give thanks to those people for teaching me those particular skills. And he was a hard taskmaster. In this day's parlance, he'd be called a bully. He was a tyrannical bully in many ways, but he was a terrific teacher. And I was very fond of the way in which he had this approach to learning that was not just at the clinic, it was actually at the admin level teaching the practice managers. It was at the doctor level teaching doctors to be managers. It was at the practice level teaching physios to be focused, to using the skills they've gained clinically to then become commercially successful as well. So, that opportunity again came along because the Lifecare business then became part of the medical business to form IPN. And that's where I came across Ralph, because Lifecare's business was really too small to live in the capital market, to be honest. Very difficult environment living from one month to the next on what the P&L is or how many acquisitions you've got to buy, which is how the capital markets work. So I've over-talked that, but it sort of fits together.
Well, I guess, and as again, segue into, you've gone through your clinical role, you've gone through an admin managing developmental role on that business side of it. And now you've kind of moved into another bit of a phase, which I'm sort of thinking of as your innovator investor phase.
Yeah.
That is, you're a director and you have ownership in a couple of companies. One is the Melbourne Stem Cell Centre and Magellan Stem Cell Laboratory. So I'm guessing they're linked. One produces them, one uses them. Is that the way it works?
Yep, that's that is how it works. And that was also back in 2013. I was approached. We were still working at Life Care, and one of the partners there and I were approached by a couple of doctors who were looking at using stem cells. There'd been stem cell treatment, in fact, in canine and in animals quite successfully. And there was a loophole in the Therapeutic Goods Administration that enabled people to use human tissues for treatment for themselves, autologous treatment using their own tissue for themselves. And there was ways of harvesting mesenchymal stem cells from tummy fat and then growing the cells in a media and isolating the actual stem cells and then growing them into a therapeutic dose. So we set up a laboratory and a clinic co-located, it's where I am now actually, to actually create the stem cells from the harvest of the patient and then re-inject the stem cells into people's knees. And relatively controversial and certainly not a proven therapy, but was able to be done under the auspice of regulation. So we took advantage of that and started treating people with stem cells, and we've now treated over 1,000 people. And the laboratory is Magellan Stem Cells, and the laboratory takes the tummy fat. More complicated than that, but takes the exudate that you get from the tummy fat, isolates the cells, incubates the cells, grows the cells, and then 8 weeks later, they give you a therapeutic dose that you can inject into the knee. So it's mainly been with the knee. And some 10 years later, we're just at the moment trying to raise finance to do a phase 3 pivotal trial using not your cells, but not your cells for you, autologists, but your cells for me, allogeneic donor cells for a wider population, because then you don't have to do a liposuction on every patient. But donor cells is what we want to try and prove are efficacious for delaying the onset of osteoarthritis and hopefully knee replacement. So put our money where our mouth is to now do this trial over the next 3 years once we've raised the funding for it. So that's really the journey that went for that. And that was really, again, someone saying, oh, look, I'm interested in this. Do you want to do it with us? Will you partner with us? So if some of us invested, a number of doctors and others invested in developing that facility out at Box Hill, and we're still going today based on that. So that became my move, as you said before, from out of what I consider secondary medicine into tertiary medicine. And my role has really been administration management. I have got a clinical background, so I understand the pathology and osteoarthritis reasonably well. But that journey has been a very exciting one and very stimulating one to take too. So it's what my day job is now.
I think the younger listeners listening to this podcast would be interested to know how it was a physio from Adelaide ended up to be doing such a cutting edge technology like the mesenchymal stem cells. What was it that the partners, they chose you and somebody else? What was it that you think they saw in you that made them approach you and not someone else?
Well, it probably had something to do with I had mentored the doctors in the practice, and they knew me well and they trusted me and they knew that I ran a good clinic. They understood that I was personable, I was prepared to take a risk, that I was, if you like, I guess it was probably fundamentally the trust I'd developed with them from working with them. You know, one of them, from his early days of being a sports physician registrar, he came to the practice and he was taught by the doctors, but I took him under my wing and helped him develop, you know, what he was trying to do with some of the biological things that he was interested in. And then another guy had come across some people at Monash Uni, and I knew him well. And they came along and they said, oh, look, we've tried to do this in a couple of places it hasn't really worked. The administrative structure hasn't worked. Will you, Michael, and the other guy's name's Ross, will you assist us to develop this business on a proper commercial basis, access to funding, bringing a group of people together? And I guess because I'd had the experience with the 14 partners, Doug, I was actually good at bringing people together and getting people to be motivated towards a clear goal. And the goal was to nobly change how osteoarthritis is managed, because there's now a move away from people wanting joint replacement surgery. There's a lot of different things going on. Exercise is very efficacious, I know that, but not everybody's prepared to do it. So, and there's a gap, particularly in the younger people are having joint replacement surgery younger and younger and younger. So there's got to be a transition treatment possibly that might get people further along before they need to have joint replacement. And we think it could be mesenchymal stem cells, but we'll be able to prove that in the next few years or not. So I think it was more, and it's probably an important value about building relationships, trust. And I've got a saying that goes well with this, that information is not knowledge and knowledge is not wisdom. So you've got to take what you learn and then work out how to apply that, see what's useful, and then that hopefully helps you make wise decisions. And I think that decision I made was also at the right time for me. I'd had it, I was still working in the corporate, and we'd actually bought the practices back from the corporate because they weren't doing a good job. And then the opportunity came up to sell them again in 2017, and that's when I was able to go more fully into the stem cell side of things. But I think trust, relationships, mentoring, a lot of it is about human interaction and honesty. And I think they're really some of the key elements that people need to consider when they're looking to build a career that takes different turns and different pathways. But, I've had my moments where things haven't worked out, and that's the thing. You've got to try different things. And I think my ventures into technology at this stage haven't proved to be greatly effective. I'm still paddling away with the app that we're working on. But look, I've always been a believer. I like doing lots of different things. It's a restless energy in me. I always seem to be ready to take on new projects. I'm always interested in listening to people's stories. And I think for all the people that I've learned from have added something to what I know along the journey, and synthesizing what they've taught me into opportunities is really probably why it's happened the way it has.
Yeah. Now, you have been a business consultant mentor for a lot of allied health practices and individual clinicians for many, many years. And you recently have published your first book, The Health Practitioner's Journey. From your experience, and I guess it's brought up from the book, can you highlight a couple of common challenges or themes that you see recurring in your consults with private practitioners?
I think there's a couple of really key things I learned from when I talked. I actually wrote a couple of these down so I don't miss them because I think they're important. I think relationship development is crucial at every sort of level. Backing yourself is another part of that. Making decisions, Doug, is crucial because people tend to be risk averse. And I always say, making a decision is more important than just making a decision full stop is more important than making the wrong decision, because you learn when you make a decision. And a lot of people aren't prepared to do that and aren't prepared to take that risk. With the what ifs. I know when I'm talking to clinicians and they go, what if, or practice owners, what if it doesn't fail, or what if a competitor comes in and sets up next door, or what if, the market changes and, there's so many physio schools starting now and all these sorts of things. And you actually talk to them about, well, that also creates opportunity. There's always opportunity there and you can always grow the size of the cake. rather than seeing the cake as it's one of the fundamental treatises of Stephen Covey was the scarcity versus the abundance mentality. Scarcity, the cake is this big. Abundance, the cake can be as big as you want it. So you might have a smaller slice, but it's a bigger cake. So I think that's the thing. Trying different things, even when you're not sure. So go outside your comfort zone. So if you're not sure, it may be an indicator that it's a good idea to go and give it a go. Push yourself. I comment in my book about how I was so scared about doing presentations as a young physio. I used to do them in front of my wife, bore her stupid while I did the presentation, got her feedback about, what I could do better or how I could do better. And I really pushed myself that opportunities came along to speak publicly, I would take them. I would say, yeah, I'll do that. Opportunities would come along to go and meet with a group of potential referrers. Yeah, I'll do that. So I think pushing yourself to do those things is really important because you never know what opportunity is going to come from actually doing that. And I think the other thing that also is important too is to be involved in community volunteer work, offer yourself up. People will be surprised. I say this to young therapists. If there's somebody you think could be a good mentor of yours, just go and ask them. Because people are going to say, I'd love to help you. Most people that have done something are keen to help other people. And I think finding a mentor, identifying someone that can help you, who you respect, who you know by reputation is a good person to do that with, they'll more often than not say yes, or if they don't say yes for themselves, they'll refer you to someone else. So I think those sorts of lessons are really, really important for people to take on board. So it's about make decisions, don't be risk averse, try different things, push yourself. You're always going to have to work hard. I don't think there's any way around that. Volunteer, offer your time. And the other phrase I use is to read widely and listen intently. Now, whether that's to podcasts or whether that's to learned people or whether that's just by going to a conference and going up to someone who's given a lecture and talking to them, that's really the sort of things you can do. And none of those things cost much. You don't have to pay money to do that. So I think they're sort of become some of the key messages I think that could help people with developing a diverse career and having an exciting career to do different things.
Yeah. And even when I was thinking back to the way that the guys approached you with the concept of opening up a stem cell centre, really you had mentored them for quite a while and you weren't thinking in the back of your mind, these guys could lead to my next business venture. It was just out of left field that the fact they knew you, they knew what you stood for, that was the impetus for them to then approach you with a concept, but otherwise it wouldn't have come your way at all.
No, that's exactly right. I think the trust and the relationships led to the opportunity, and then the opportunity. Look, I just don't do things at random. You assess the opportunity, you assess what's required, you look deeply inside yourself to see if you think you can add value, and then you back yourself to do that. And where the gaps are, you have to be prepared to find the gaps and fill the gaps. So I might need to learn more about finance. And in fact, a lesson for me is as a younger person getting business, I should probably have had a greater financial background, studied more finance. It's a regret that I've got that I didn't do because it made it harder to grasp some of those concepts later on. But that would have been a really good pathway for me at that time to study some of that.
Yeah. So what would you say has been the hardest lesson? You've almost said what it was for you as a physio, but I'll give you the reins to expand on something that you found very difficult and learnt from.
I think, are you talking about for me personally or about my view about the
No, for you
profession or the
personally, like
future?
as a physio, you've done something and you thought, oh my gosh, that was a bit brutal. What was it, and what did you learn from that?
Oh, okay. I'll never forget. It was a brutal thing to do. But when I used to go in my early days to the local football club near the clinic, I used to volunteer my time. I'd go along to training on a Tuesday night. I'd go to games on the Saturday. I used to use the players at that club, none of them are listening, I hope, as a proving ground to try things. So I'd say, well, they've got a bit of a hammy. Let's get, yeah, I think you're going to be okay. You should play this week. And I did those things to find out what would happen. And what I learned, what I learned sometimes is that can be a complete disaster and they damage it even more. Or they get through. And then you start thinking, well, how come that person got through and the other person didn't? What is it about their biomechanics or whatever have you? So I think trying things out in a volunteer environment, which is more difficult to do in a clinic where someone's departing with their hard-earned, it wasn't reckless, but it was probably a way in which I pushed the envelope a little bit and probably pushed the envelope a little bit too hard. But I don't regret doing it because I learned from it. And believe it or not, I got much better then at judging when people would be right and be able to play. So as a future practice, it became a very good thing. And, you know, we used to treat, Steve Sander and I used to treat so many different conditions back in the day in the 80s when you treated 4 people an hour. Doug, you may remember those days, not
I
2
do.
an hour. And
Well,
you
6
had
an
to be
hour.
innovative with what you were doing, and they did a lot of different things. They'd come into the clinic and they'd not just have treatment, they'd ride the bike, they'd do exercises with others, they'd work in groups and so on and so forth. So I think some of that was probably a little bit kamikaze because it became a bit overwhelming to have multiple people all doing things at different times. And I think, you know, that had to come to some degree of a crunch eventually because it was not going to work in the long run. But I think there were the things we did, and there's some regret about some of the ways we did that. But look, we had a great time, and we think the patients loved it. You'd have to ask them.
For $200 or less, so we'll say 200 dinero or less, what is your best book, app, tool, or other investment that you found assisted you in your development?
It would go right back to there's a couple of things. It would go right back to pivotal books that I availed myself of going way back in the day. I mean, I think you wouldn't get it. It probably costs a lot more than $200, but the Clinical Sports Medicine of Bruckner and Kahn came out in 1990. They're doing their 6th edition now. In fact, I asked Karam Khan to write the foreword for my book, and he kindly has done that. And I've done a little bit of work with them on their 6th edition, but that was well worth a spend. It probably would be some fancy app-based thing now. But the other thing that many years ago I bought in a plane was a portable scanner. That was very useful for me for when I was all over the place, being able to scan, pieces of paper, documents. Before there were scanners coming on board, but back in those days, it used to be just a scanner. You had to buy the whole scanner. Now you can get the photocopier, scanner, collator, in those sorts of systems. But those 2 things would probably be the best value things that I bought for less than $200 for sure.
I thought you were going to say your wife's wedding ring there for a moment, but you didn't quite get there.
Well, the partnership with her is reared 4 children, and we're very strong in our relationship after 37 years. So she's been crazy, fantastic supporter of me and my craziness and some of the things that I've done. And I've got to say, having someone to back you like that, that sounds all right, why not give it a go? So I think knowing someone who knows you well that says, give it a go is worth, huge amount.
It's a great bedrock to start from. So talking about crazy things, what would you say has been your most out on a limb decision that you've made in regards to career, and what was the outcome of that decision?
Um, I thought setting up an online learning portal back in the probably 2010 was a really good idea. Thought people would access it. It was probably just before a lot of the online learning stuff had come to the fore. It was under-resourced. We thought we knew more than we did. We talked to some people that put us down the wrong path. We tried to invest more in it. We just couldn't make it work. We couldn't sell it. We couldn't do anything much with it. It was called Kelsey, and we eventually just had to let it go. Fortunately, we hadn't invested a lot of money in it, but it was something that I thought I knew more about that sort of thing than I did. I didn't research properly. And that's, funnily enough, it's been the other challenge with the other app that I went into, about going into things that I didn't have any training or expertise in. So some of those sorts of businesses, fortunately, I got out without losing my shirt. But, if I had my time again, I would probably not do those ventures, to be honest.
What three things in your...
I learned what not to do. That's probably
Well,
good.
that's the learning in itself, isn't it?
Yeah, it is.
Could you identify three things in your professional life that stand out for you as either highlights or lowlights?
Look, I think relationship building is probably the most pivotal thing. I've tried never to burn a bridge with people that I've disagreed with, and it's amazing how often opportunities recome with people you've kept a relationship with. So I think relationships is probably the key thing. I think the ability to back yourself, to look at the risk profile of what you're going to do. And, my wife used to say to me, "Can we afford to lose that money?" Yeah, we can afford to lose it. So I think mitigating risk on the back of not putting everything on, red at the casino. So diversifying your interests, because I'm not very good at sitting in one place at a time. So having a diverse range of interests, not just through your professional career, but, I learned Spanish. I try to play the guitar. I still try to surf. Having those interests is important to take you away from what you do. But I think the diversity of your interests, and other than that, I think probably listening is such a key thing. Empathic listening, deep listening to people and their story, be they patients or be they family or be they friends or be they patients that you've seen or business colleagues that you've got. So by doing that, you get quite good at reading people. And I think I'm pretty good at reading people and what their strengths are and where the pathways might not be the right way to go. So I think probably those sorts of things are what I take away from that.
I think that also speaks to the fact that a lot of physios, one of the things that why I started this podcast was to try and encourage physios that are maybe in that sort of sub 10 years to consider and realize that, there are a lot of pathways that this profession can avail them of, innovator, business, research, clinician, leadership. There's lots of them, but I think the skill set that we're given as a physio, like you just sort of talked about, empathically speaking to patients was sort of like your fertile ground for learning that, but then that does translate into friends, family, relatives, business partners. So you could say the same thing translates the information you've learned about helping people, being an empathic listener, that sort of translates into other areas. So in some ways, I think the skills we're given as a physio, if we recognize them as a skill, even though we may just have got them through hard grunt, they do translate into a lot of things that we can apply in other areas outside of our professional career as well.
You know, it's funny you say that because with my book, I've created a 4-stage model, but overriding the model is what I call harvesting knowledge, right? Which is what we do right from graduation right through to the end of our career and beyond. So it's the harvesting of knowledge as you go along that actually helps you identify some of the other opportunities. And to do that, you've got to stay in. To stay in the profession is something that is not happening now for a whole range of reasons. And we can't really go into the whole detail about how people are being trained and whatever, but I think physio needs to be aware that it was a hands-on profession, and that touching is important, that manual therapy is important, that actually providing external input into someone's body to help them heal is important. And I just see that those skills are not as valued as they used to be with some of the clinicians we see coming through. And we feel we have to train manual handling and train clinical reasoning into graduates when they come out, because that's where the fulfillment comes and the satisfaction of achieving a result with a patient that gives you that great feeling that keeps you attached to the profession, I think. And then you learn that, and then you move on and you say, well, look, this can be a more commercially successful opportunity for me than perhaps I've identified. Not for everybody, but for some. And then that opens doors in other directions as well. So I think we've got to all do, the likes of yourself and myself and others, the best we can to actually show people that there is a pathway, and that, I use the word journey for my book because I'm still on that journey. I'm still on the journey of learning. I'm still doing different things to what I was doing, using the skills I've gained. And, buying and selling practices is a good way to actually earn, a very wise mentor of mine once said to me many years ago, Michael, you need to be in businesses that will make money for you while you're asleep. He said that you can control. So you run a practice, you can control the inputs and the outputs of the practice. If you buy shares, you can't, you're at the prey of the market. If you buy property, real estate can do well or not do well, or interest, whatever it is. As an investment in yourself is a key thing that will create wealth for you as you go forward. And then your strength and power lies in your power to produce, not in your job. I think that's a really important message for the younger physios as well. Invest in yourself, because your power to produce has much more carriage than what your job might be at any particular time.
And that probably speaks to the next question I wanted to ask you, which was, if you could step back to your younger self, what 3 pieces of advice would you like to share, knowing what you now know?
Write that down. What I think, getting back to that, what things that I would do, that I would have done or could have done that would have helped me later in my career are probably more along the lines of different types of education. Probably I mentioned finance before. I think finance is a commodity that certainly will help you in business. You don't have to do a lot. I've done a lot of reading of books, but having something more formal in that respect might have been good. I think probably getting out of things sooner rather than labouring them till they're dead would be something I would do too. I'd be more nimble to move out of something that I could see wasn't working particularly well. And I think I'd probably be a little more evaluative about the types of practices that I got involved with or bought into at different times than I would be now. I think I've got that's a learning thing too, but I think knowing the fundamentals of what I know now was a hell of a lot easier if I'd known them earlier, but that's a statement that everybody can make. really.
Hindsight's worth $1 million.
Isn't it? Right?
Looking forward, where do you see, or where would you like to see the physio profession going in the next few years?
I think we need to get the focus back on physios being hands-on. I'm getting really tired of hearing people say to me, "Oh, I go to physio, they just give me exercises." I think we need to embed the understanding in the profession of evidence-informed practice rather than evidence-driven practice, because you know the model of the three legs of the stool when it comes to evidence-based. I think we need to really make sure we're looking at that in a more holistic way. So I think the touching side, the manual therapy side, the evidence-informed practice, I think we need to really look at how we might instruct physios in the skills you mentioned before, like business and HR and develop growth, personal growth, career development, career orientation. And if you like, that's probably the motivation behind my book, because at the end of the book, I use a couple of avatars of people who've have harvested knowledge and gone and done different things from what they did first up in their profession. And I think that's what we need to see more of those models. But I think that the training in business, I have talked to the APA about this a little bit, some sort of basic business training, because you would know that most of the training that people get comes from their peers. The research shows that people who want to get information about their practice or growing their practice go to their peers. And I think maybe the profession could have a bigger role to play in that. So, hands-on, really getting a better grasp of the evidence base, manual handling, clinical reasoning, training in business would probably be, that's the direction I'd like to see the profession go, because it's a wonderful profession with enormous opportunities, and it's only going to grow if we can continue to have that connection with the public as to what physios do.
Yeah. And where do you see yourself going or focusing on for the next few years, Michael?
Well, the next few years is about this trial, the trial for the stem cell product, for the osteoarthritis product. We need to provide evidence for the skeptics that this treatment is efficacious and is better than placebo and has a place in the regimen of treatment for osteoarthritis. Teaching others what I've learned is really a key part of what I want to do. I'm very keen to try and get my book out there as much as I can, but also to see if I can create opportunities of being able to talk to larger groups, rather than most of my consulting has been one-on-one or small group interaction. But I think I'd like to create an opportunity to be able to do some speaking opportunities to larger groups, be they larger practices or associations or those sorts of things. So that's what I hope to do over the next couple of years before my use-by date's up, Doug.
Right. Well, I'm not sure who determines that use-by date, but for the moment, I'd like to say muchas gracias and thank you.
Perfecto. De nada.
Thank you also for, elaborating on, what is an extensive journey as a physio, from that clinician through the admin, business, innovation, leadership, and now mentorship, and I guess giving back in some ways through all your wealth of knowledge. So much thanks from all of us on Physio Plus 10, and the younger generation will get a lot of ideas from what you've shared with us today. So thank you very much, Michael.
Thank you, Doug. It's been an absolute pleasure. I've enjoyed it immensely. So thanks very much, and good luck with this business you're doing too.
Thank you. Thanks so much for listening to this episode of Physio Plus 10, in which I trust you gained some valuable insights. It'd be awesome if you could leave your 2 cents worth as a review or rating of this podcast, and I look forward to sharing the story of another trailblazing physiotherapist with you in 2 weeks' time. Stay safe. Bye for now.